Have you ever wondered if the mysterious illness that you're suffering from could actually be something that doctors can't detect? What if I told you that a small microorganism living inside all of us actually has the potential to ruin all of our health? And all humans have this microorganism living inside of us, and when the body is in a healthy state, it presents no problems. However, when it grows out of control, it uses your body as a host, depriving it of nutrients and weakening your immune system, leaving you more likely to acquire secondary infections and diseases. You know, when I started my nutritional work, I was excited because I knew I could help many people. Well, I knew because I had tried a lot of what I was doing and learning on myself and healed myself, and I knew from the results I was getting when I worked with people. But what I found was that an awful lot of people were coming to me without any diagnosis. They were coming to me for help because they didn't have a clear idea from their doctors what the actual issue was that was making them feel poorly. Even though these doctors ran the regular blood tests and they usually came back within range, these people still felt very unwell. Well, I want to share with you some of what I've learned from these experiences in the hopes that maybe this will ring true with you and it will help you to begin to uncover the root cause of your mystery illness. And I also want to tell you about a very special program that I've just created that I think could really help you to find your own answers working with me. But more on that later. First, let's give you some background on what Candida yeast overgrowth is. So could this mystery illness that you have actually be from yeast overgrowth, otherwise known as Candida? Because Candida manifests in different people in various ways, it often goes undetected for many years, and yeast overgrowth is frequently missed by conventional medicine. The symptoms experienced cover a broad range, and they can vary quite a bit from person to person. These symptoms are often interpreted as other maladies and treated with unsatisfactory results. Most doctors don't know how to properly test for, diagnose, or treat chronic Candida. And for this reason, many physicians don't really believe Candida is a legitimate health condition. Importantly, chronic and systemic Candida is now being linked to more serious diseases. So what is it? Candida is a yeast. It's a kind of fungus. It's part of our microflora, and it's in everybody's body. The kind of yeast that can cause problems is Candida, a specific strain. This yeast likes to live in the inner warm circles of your digestive tract, including the gums around your teeth, the crevices of your tongue, in your sinuses, in the female vagina, in your armpits, under your breasts, and even under your toenails. Everybody has some Candida or yeast present in their body, and it usually is fine and benign. It just cohabitates with us without issue. It becomes a problem when it takes over and becomes an overgrowth. Then it starts to compete for nutrition, and it deprives our body of nutrients that we need. It also stirs up inflammation and releases toxins. When Candida is chronic, digestive secretions in the pancreas and liver are decreased, which in turn leads to more overgrowth, and it becomes a vicious cycle. So instead of feeding your organs and your body systems, you end up feeding yeast. This graphic shows how yeast affects overall health. It weakens our immune system and leads to viral infections. It can trigger gastrointestinal and bowel problems. Environmental sensitivities seem more pronounced, and they can also trigger Candida. Nutritional deficiencies are also very, very present because we are not getting the nutrition we need because the yeast is taking it. Mold and seasonal allergies can be more pronounced. It can manifest in pain through headaches, body aches, and low energy. It also has a toll on emotional health and increases stress, and you may experience brain fog. We also have increased susceptibility to food intolerance whenever our gut is impaired. Here's some disease states that have been linked to Candida, and when you see these, they should be a flag for you that this could potentially be what's driving your misery. Any kind of skin condition, any kind of autoimmune condition, as you see here, very, very common. Bowel issues are very common as well. Do you have any of these? So what are some of the triggers that cause Candida to run wild? Anyone that's been treated with numerous antibiotics or broad spectrum antibiotics, which means anyone who's ever been hospitalized, and most of the people on the planet, probably has some damage that's been done that leaves them open to having more susceptibility to yeast overgrowth. Certainly a diet that has a lot of sugar and simple carbohydrates contributes to Candida, and hormonal changes also could contribute. Birth control pills in pregnancy are another trigger thing to look at. Steroids, anyone who's been treated with steroids for any kind of condition, these suppress the immune system and can lead to Candida. Also, anti-ulcer drugs such as Zantac, which depletes stomach acid, can lead to this condition. Sexual intercourse from another partner that is infected with Candida can be transmitted that way. A lot of people don't realize that. And if you have diabetes or you're pre-diabetic or have metabolic syndrome, you most likely have a Candida issue because sugar dysregulation is very suspect for creating Candida overgrowth. And of course, leaky gut can either be caused by Candida, or leaky gut from food allergies and other things can cause Candida to get a foothold. Do you have any of these symptoms? Fatigue, feeling sick all over, no energy, decreased libido, yeast infections, altered bowel function, allergies, bloating, depression, food and chemical sensitivities, irritability, headaches, body aches, premenstrual syndrome, anal itching, low immunity, tingling, brain fog, or have poor decision making and memory issues? All of these could actually be an indication that you have Candida. Here are some other conditions that we know are linked to the problem being Candida. Any skin conditions such as acne, psoriasis, or eczema, and any autoimmune condition that's listed here, such as fibromyalgia, rheumatoid arthritis, MS, IBS, lupus, Crohn's disease, or just numbness or chronic hives, or allergy issues like sinusitis or chronic asthma, all are very suspect to be Candida. You will also know if you have Candida if you have a strong craving for foods that are high in sugar and carbohydrates. This is almost always a clear indication that the yeast is screaming to be fed. And many people feel that they're weak, they can't control themselves. This leads to the tape of negative thoughts in their head, when really it's the yeast that's screaming to be fed, and it's not their fault that they're craving these foods. Once they go through a program and get it under control, amazingly, these cravings are eliminated. So we're going to talk more about how to do some of that. But first, a couple ways to check for Candida. There are some tests, a blood test through serum, or you can also do stool testing or saliva testing. Even a blood spot test can help determine if you have Candida. These are all done by specialty labs, and you will need to work with someone who understands how to read these and interpret the results, as well as a specialty lab that knows how to conduct the tests. Regular lab tests that doctors use, checking antibodies in the blood or testing stool for yeast, are not sensitive enough, and they don't pick up people who have yeast. So they're not a reliable way to check. So even if you have a physician that does check for it using a conventional lab and not a specialty lab, it probably won't get picked up even if you do have yeast overgrowth. I've created a simple self-test that you can do to determine if you have a likelihood of Candida. Here's the link to go there and take the test. This is quite a reliable test that I use quite a bit with people that I work with. If you have a score of 60 or above, you should definitely follow up with a test, exam, or just get started with treatment. And I'm going to tell you more about that as we go along. else can you check? Well, people with yeast overgrowth do have some similar sets of symptoms and complaints, and that yeast questionnaire is a very good way, and it's very easy and private. It's a very good way to evaluate yourself. Once you know what to look for, it can be easy to see. Let's look at some physical signs of Candida that are very common. Do you have subtle dry cracks around the corners of your lips? This means you have yeast. And look at your tongue. Often a thick plaque of white is on the back of the tongue, and it's sometimes on the palate. Or maybe you have brittle yellow nails. Yeast is often found between the toenails or actually on the fingernails as well. Let's look at conventional Candida treatments. Most doctors treat yeast with antifungal prescription medications for just a few days. Prescription antifungals should probably be taken for more like 10 to 14 days, and even longer in some cases. This is according to some functional doctors that I've spoken with about it. So be aware that many people, especially those that have had chronic recurrent yeast overgrowth for a long time, can take these medications over time repeatedly, and soon they become resistant to these medications. But there's another way to manage Candida, and that's using herbal antifungals. These are much safer and in many cases do a better job for people if you know how to use them correctly. Both prescription and antifungal herbals do a good job of killing existing yeast. However, if you don't change your diet and stop feeding yeast, it will just come right back. Unfortunately, most doctors never discuss dietary changes with their patients, so the yeast just comes back. But a better way to get yeast under control is through a multifaceted approach. This really works a lot better for long-term resolution of the problem. The first thing is you have to change your diet and remove yeast-feeding foods. Second, you need to add yeast-clearing foods and nutrients that support the detoxification process so you can remove yeast. You also need to address any damage to the gut, aka leaky gut, and rebalance intestinal flora and improve nutrient absorption so you have a strengthened immune system again. Changing your diet is a must. Sugar feeds yeast as well as cancer. Simple starches turn directly into sugar, and they're just as good at helping yeast to thrive. Basically, any food that breaks down into sugar feeds yeast, so these must be eliminated. So eliminating sugar in all its form is key. Things like soda and sweetened beverages of other types, snack bars, protein bars, and high glycemic fruits must be eliminated. Also eliminate corn syrup, which is found in many cookies, crackers, and most condiments. All breads, biscuits, muffins, these are made with yeast, so you want to get rid of those as well. Anything that's made from white flour, like crackers, baked goods, cookies, and snacks. All packaged and processed foods contain hydrogenated or partially hydrogenated oils. Food coloring additives also should go. Processed cheese and cheese food products and aged and fresh cheese should be eliminated. Anything that's a frozen entree, even most naturally, labeled natural, should be eliminated because they do contain yeast. It's used as a filler in many foods. Deli meats and other processed smoked meats such as bacon, smoked fish, ham, hot dogs, sausages, corned beef, and pastrami. You want to eliminate all those. Those feed yeast. All condiments contain sugar, vinegar, and other additives that must be eliminated when you're on a yeast-clearing diet. Also, eliminate malt products, as these feed yeast. Edible fungi, mushrooms, and truffles are also not to be eaten when you're on a yeast-clearing regime. Even some fruits, like melons, watermelons, honeydew, and cantaloupe, these are prone to growing yeast, so you want to eliminate those as well. Anything that's in a can should be eliminated, as well as any dried fruits because they're very high in sugars. Remember, leftovers grow mold if left in the refrigerator. You can inhibit mold growth by freezing your leftovers. Any alcoholic beverage also is a fermented product and includes a lot of sugar and yeast. These also will feed yeast, so you'll want to eliminate those as well. While you can never eliminate all the yeast from your diet because yeast and molds grow naturally, on the surfaces of all fruits, vegetables, and grains. Do the best you can and follow this as a guide. Don't forget to drink enough water. During any yeast clearing program, you must maintain adequate hydration. Water is essential to help flush the system of yeast and other pathogens during the yeast killing phase. Try and drink half your body weight in ounces of water a day. Remember, coffee, soda, and juice are not the same as water. And also, consider investing in a water filtration system and avoid tap water. How long will I have to eliminate these foods? That's a question I hear a lot. It depends on how severe your Candida is, but in most cases, you'll need to eliminate yeast-producing foods for 3 to 6 months. And if you have a very severe case, you may need to go as long as a year. You can get a yeast-killing prescription medication from your doctor. The two most common are diflucan and nystatin, and here's some of the side effects. Diflucan can cause nausea, vomiting, diarrhea, stomach upset, pain, headache, dizziness, and even hair loss. Nystatin has common side effects of mouth irritation, diarrhea, nausea, vomiting, or stomach upset. The alternative to prescription medications is to use herbal antifungals. This involves using these products for a minimum of 30 days, and I've actually found this works much better, especially for systemic cases. It's essential to maintain your dietary changes while you're on the herbal antifungals for 3 to 6 months and sometimes longer. Some people do need to stay on the herbal antifungals and nutrients to suppress their yeast for longer periods of time. So now that you have the long list of foods that you shouldn't eat, what should you eat? Well, let's touch on just some of those. Any food that's alive has natural enzymes, so raw foods from vegetables that are low glycemic and fruits that are low glycemic in very strict amounts will help you. More raw organic food is always a good way to go. Your probiotic-rich foods and fermented foods that are naturally fermented are also very good because they contain active cultures, and this helps repopulate the good bacteria, and it helps to crowd out the bad bacteria and rebalance the gut. Another very favorable food is coconut oil, and it's very anti-candida because it contains lauric acid and caprylic acid, and candida does not like to grow in this environment. It helps to strengthen our immune system. In addition, oil pulling using coconut oil has been used for centuries by cultures to help to eliminate toxins. Both onions and garlic are very good to prohibit candida from growing. They're both sulfur-containing vegetables, and they both have strong antifungal, antibacterial, and antiparasitic properties. Oregano and ginger are both also very good anti-candida foods. Oregano is very powerful in its antifungal properties, and yeast does not thrive when oregano is around for very long. Ginger is very good for detoxifying the body. It helps our circulation, and it really helps improve and tone the liver. It's also very stimulating to the immune system. It's been used for centuries as a digestive aid, and it reduces intestinal gas. So this is a very soothing and an important aspect of ginger that helps anybody that's on a Candida yeast overgrowth program. Olive oil contains powerful antifungal properties too, and it stimulates the immune system to help respond to Candida. Olive oil and leaf extract has also been shown to stabilize blood sugar levels, and this is important for Candida people because elevated blood sugar levels can feed your yeast overgrowth. So this helps to keep that in check. Make sure you eat your olive oil raw to obtain healthful properties, since once it's heated, these are destroyed. Lemons and limes and pumpkin seeds are other good anti-candida foods. Lemons and limes stimulate the peristaltic action in your colon and increase the efficiency of your digestive system. They're both great options for seasoning your food, and they're also the only allowed acids besides apple cider vinegar when you're on an anti-candida yeast clearing program. Pumpkin seeds are great. A lot of people don't know this, but they're very high in omega-3 fatty acids, and they have antiviral, antifungal, and antiparasitic properties. And omega-3s are important when we're doing candida clearing because they help with pain and also improve skin conditions. Can Cayenne pepper gives natural support to our digestive system and to our immune system. It helps us digest food and reduces constipation by aiding in cleansing the bowel of Candida and other toxins. It's also very good to increase our metabolism, and it helps to reduce symptoms of fatigue. Green foods like chlorella, spirulina, parsley, and really all leafy green vegetables help to alkalize the body, and a slightly alkalized pH is less susceptible to yeast overgrowth. It also gives us great fiber and acts as a scrub brush to flush out dying yeast. Replenishing and rebalancing is another important step that's often overlooked. It's very important that we add supplements to help crowd out the yeast and rebalance intestinal flora to improve nutrient absorption and strengthen natural immunity. Please be aware that most of what the health food stores sell are very low quality. They have many inert ingredients and they really don't do the job. Using the correct herbal combinations is critical to success in getting your Candida under control. How and when you take these preparations is also very important to properly rebalancing your intestinal flora so healing can occur. Reestablishing friendly bacteria in your gut is essential to making the environment inhospitable to yeast. It's very difficult to get yeast under control without the aid of supportive supplements. We simply cannot do this using food alone. Remember, if you have Candida, you have leaky gut. So until you repair your gut and reestablish proper digestion, you won't be getting proper nutrition and your recovery will be impeded. This step is essential to long-term recovery and cannot be overlooked. Do you think you may have Candida after listening to this? Here's what to do next. First, find out if you're feeding yeast by taking the Candida questionnaire. Just click on this link and it will take you to the download. Take your time, fill out the questionnaire, and see how you score. If you score 60 or above, you definitely need to take some steps to get yeast under control. And now I'm going to tell you how I can help you do that. I've created a 6-week Candida boot camp that you can sign up for. It's a very small group. It's limited to only 10 people, and it begins on May 6th. We'll meet once a week via Skype through June 10th. I've spent a lot of time working on how to create a small group program that could really give people the individualized attention at a better price, and I think I've come up with it, and I'm so excited to tell you about it now. The 6-week boot camp includes all the supplements you'll need to get through the yeast clearing program. All the yeast killing herbal supplements, the detox support supplements, digestive support supplements, and rebalancing supplements have been handpicked by me. This 6-week Candida boot camp has been modeled after the same program that I've been using successfully on an individual basis for years now. All of these supplements are the same ones that I've used to help many other clients who've come to me for help with their own mystery illness. You won't find any of these supplements at health food stores or any online retailer. I'll be your virtual guide and support you through the process for 6 weeks. Every week we'll move together to the next step. What you'll get will include what foods to eat and what foods to eliminate, with a much more specific list than what I've given you here. You'll also get a shopping list that has all the best foods for yeast clearing that you should include in your diet, plus my very own delicious yeast-safe recipes that I've created. These weekly meetings will be devoted to step-by-step instructions each week with handouts and tips for success, and that will comprise about 20 out of our 40 minutes of meeting time. So you'll have at least 20 minutes every week so that you can ask your specific questions and get support. You'll also be with other fellow Candida Boot Camp enrollees for that added support and exchange that's so important to help us as we're making these lifestyle changes. Are you ready to reclaim your good health and get rid of your mystery illness once and for all? Sign up for my Candida Boot Camp. I'm offering you a special early bird price of $355 if you enroll before April 30th. After April 30th, the cost goes up to $430. So take advantage of this special extra savings of $75 and enroll before April 30th. All you have to do is go to this link and sign up. I can't wait to get started working with you so we can kick Candida's butt.